Hello friends, myself Asha Talwar from Radiance Diagnostics. Did you know more than 15 crore Indians suffer from knee issues and over 4 crore need knee replacement? But the good news is that there is so much you can do before reaching that stage. Guess what? Today we are at Dr. Ameya Velinkar's clinic. Come on, let's find out. Welcome to OrthoSeries on Viewbox by Radiance Diagnostics. Today we are diving into a topic that affects millions of Indians with renowned orthopaedic and joint replacement surgeon Dr. Ameya Velingkar.
Hi.
Hello sir, thank you for joining us.
Thank you.
Doctor, why is morning knee pain and stiffness common?
So, morning stiffness is basically the first sign of early arthritic changes. If you are looking at this knee, when you start getting this very early wear out of the cartilage, the knee tries to heal overnight, and as a result, when you get up in the morning, you first find it a little bit stiff for the first few steps, after which you feel good. Understand, most of our joints are auto-lubricating joints. The more you move them, the better they are.
Okay. Sir,
Auto-lubricating.
Okay.
So there is no external lubrication which you inject in that. There is a synovial fluid which keeps this cartilage smooth, and the more you move, the better you are. So if a patient who is supposed to come to me for a knee replacement comes and asks me, doctor, should I rest this knee? Absolutely not. The more you'll move, the cartilage will improve, the muscles around will be more healthier, and the patient will feel much better.
Doctor, as Indians, are we doing anything wrong that's damaging our knee early?
So, Indians are quite lazy for exercises. So the main cause here, the main disease in India, I would say today, is obesity and lack of exercise. In my clinic, I have seen most of the people, they give the last priority to exercise. As kaits na kam, chal walk kya. Whereas abroad, they first start with exercise. They see to it that they are healthy, and they work hard throughout the day because they are healthy. It's not about Indians.
So how do I know it is arthritis or just a sprain or injury to my knee?
So understand these two things very simple. Arthritis, you will get maximum pain early morning when you get up. This is arthritis. Once you start doing your day-to-day schedule, you will feel pretty good as compared to the morning. Sprain, the moment you start doing your work, you will feel more and more painful, and the swelling will increase. Arthritis does not cause so much of swelling unless you are talking about the stage 4 arthritis, whereas sprain will cause maximum swelling in the first 2-3 days after surgery, after the sprain, following which you will be fine.
And if I am only 35, doctor, so am I too young for knee arthritis?
Arthritis has no age. If I try to enumerate, there are more than 100 different types of arthritis. Arthritis can affect anyone. You must have heard about something called juvenile rheumatoid arthritis, which happens in a kid. Rheumatoid arthritis can happen for any lady, generally between the age of 30 to 40. However, today, the osteoarthritis, which makes the main burden of arthritis, that is 90% of arthritis is basically osteoarthritis, is also quite common for young age. For the same reason, we don't maintain our BMI, that is body mass index, and secondly, we don't try to keep our muscles healthy around the joint.
So, doctor, what is the first 3 things we can do, like in 30-40-year-old with knee pain?
Most important thing, try to keep your body weight within your height limit, that is what we call as BMI. Second thing, regular exercise is the most important nutrition to the joint. As I started my talk, all our joints are auto-lubricating joints. So the more I move it, the better the joints become. So the more activities you are in, you are more healthier. That's the main tip for the people whenever anybody feels that yes, I think I have started getting the grade 1 arthritis, what we spoke about stiffness, and early morning when you get up you don't feel like even waking up from the bed. The first thing you start is get into some aerobic exercises. You can name it anyway. You can call it I'm doing yogasana. Some people will say I want to go to the gym. Some people will say I want to do free weight training. There are various types of aerobic exercise. Get into this aerobic exercise because that keeps your muscle active and that helps the cartilage to be better lubricated.
So should I stop walking if my knee hurts?
Exactly. This is what I always like to point. Never stop walking. There is not a single knee joint or a hip joint which has worn out in a marathon walker. Okay,
Yes.
so walking will never damage your knee joint or your hip joint or your ankle joint. What can damage a knee is avoid excessive squatting, like what we do on sitting on the Indian toilet, or sitting cross-leg on the floor, because when you start getting up from that, you start getting excessive load on the knee which can wear out. Excessive climbing of staircases, running up and down. However, all these activities also you can do provided your BMI is between 20 to 25.
Okay.
A healthy body weight, you can do everything.
So is this answering our question, how much is too much? Can you tell us like how much is too much, sir?
So basically, if our body always tries to develop to what we are doing, if today you are walking for 5 kilometers, that is too much for you. But in 2 months' time, you will say that I can easily make it 7. I can easily make it 10. So exercise has no limitation,
Okay.
provided you have your regular health checkup and you are not cardiac compromised for the problem.
Okay. Can simple remedies work, sir? And what should I do and what should I not do?
Yes. So the simple remedy is, see, you are in your stage 1 arthritis. You started feeling that yes, my joints are stiff. It's painful. First, try doing some hot fomentation. Start doing some exercises around the knee joint. So we have the active SLR, we have the bending, we have the static quads. You can start cycling. Cycling is one of the best exercise. If you're a good swimmer, start swimming and get more active to control your arthritis.
Okay. So does ice or heat application actually work, sir?
So ice in arthritis is only in an acute phase. So if your knee is extremely painful today because you had probably gone for some hiking, you had gone for some mountain climbing which you're not used to. The next day your knee swells. We call it in orthopedic a transient synovitis of the joint. That is a very transient thing. Icing will immediately cool down that swelling and go. Otherwise, for arthritis, like you are getting a neck pain, you're getting a back pain, you're getting a knee pain, hot fomentation would always work.
Okay.
Some patients feel that yes, hot and cold also does good. So I would prefer them to do a hot fomentation in the morning, maybe an early morning hot water bath, that itself is good. And maybe in the night if he feels that no, my knee joint is really hurting, just do some icing before he goes to bed, because icing is one of the best painkiller I've ever seen.
So doctor, when should we finally see a doctor?
So I would put it, if you reach from stage 1 to stage 2, and now we have started talking about a stage 3 arthritis, where there is multiple level, you see the cartilage is worn out. This patient will present to you with a long existing knee pain, probably around 3 to 6 weeks. Okay, he will present with you with crepitus in the joint, which common men will say जोल्ल्या दोपर किंवा कुरकुरकुर आवाज येता, or what you call it as, you know, a rusted joint. A common man will say rusted joint. So a rusted joint or a crepitus in the joint, like we orthopedics say, it is reaching the stage 3. Or the patient has a deformity. You have seen in some villages, you know, the old ladies, they walk with a bow leg, or some people are there with a knock knee, they walk with a knock knee. So that sort of a deformity, or the sound in the joint, or the pain. Now when I'm talking about a pain in the joint, it is not a normal pain. Like you and I, everybody has some pain in the morning. This is not that pain. This is a pain which will make that person home ridden. So basically, if you are going out for a wedding, and if your mother says that no, I really don't want to go for that wedding because I will not be able to make it, and I'll be very painful. That's the pain. If you find a person like your old granny at home who cannot walk from this chair to the door, and she will probably take another 4 to 5 minutes to walk, that sort of a pain, or a pain where you are consuming a painkiller almost every day to control the pain. These are the time when you should meet a doctor and see if you have some options available. And that's the time mostly the doctor will ask you for an X-ray of the joint. If he's a young patient, most probably it would be an MRI of the joint to quantify how much is the cartilage damage. And accordingly, he would probably suggest you some more aggressive physiotherapy, some different type of medications, which could be some collagen peptides, some vitamin D, calcium, some painkillers, and then probably if that does not solve your problem, he would definitely suggest you some surgical options.
Sir, what tests are normally done to confirm arthritis?
So, if a young individual comes to me with joint pains, I have in my mind it may be rheumatoid arthritis, it can be uric acid, it could be ankylosing spondylitis, it could be lupus, SLE. Okay, so in such, I would do some routine blood test. I would get an X-ray done, standing X-ray. If it is a knee, the weight-bearing joints, we prefer to have standing X-rays to know what exactly happens to your knee when you're putting your weight on it. And in younger patient, an MRI scan of the joint to understand any other sports injuries, ligament injuries that it will have.
Do I really need surgery or I can still avoid it, sir?
So, there are various surgeries for arthritis. Now, since we are all talking about knee, if a young patient comes to me and unfortunately while playing football he had a cartilage damage, I would consider cartilage regeneration. There are a lot of surgeries which we do nowadays. It is called as autosite chondrocyte implantation. What autogenous chondrocyte implantation means is I put a camera inside the knee, we call it arthroscopy, and I would take a piece of a cartilage. I send it to the lab, get chondrocytes done, and then I see the patch and I patch it and put the chondrocytes of the same person with the same DNA matching.
Oh, okay.
There's another thing where what we do is when we are talking about this knee joint, this cartilage or this cartilage is never weight bearing. So these are not so important places where the cartilage is. So we use a drill hole, we make a hole here, punch out the cartilage and put it in the weight bearing area. So only if your weight bearing part is damaged, I can transfer the cartilage from here to there and you can get a smooth cartilage. So it's the same cartilage from a less required space to a more required space. And this is called as chondrocyte implantation. I would do. Then there are various osteotomies which we do in a surgery. So we take a cut of the bone, connect a computer up and down. Under computerized, we try to correct the mechanical axis of the knee. A bent knee will be slowly becoming straight and becomes perfectly straight. I put a small plate and hold it. This is called something like a high tibial osteotomies, distal femoral osteotomies, and I compare this to your car tire getting wheel balanced. When I tell you that your car tire is wearing out on one side, you would immediately take it, you'll correct the alignment and see that the other side of the tire wears off, which they also do it computerized nowadays, so that you get an even wear out of the cartilage. When a patient 60 plus or 70 plus comes to me with a similar problem, yes, I would definitely suggest him go for a knee replacement. So what is a knee replacement? That's the most important thing. So most of the patients come in, ki dotor knee replacement म्हणल्यार तू सगळें दोपर काढून नवे घालतलो. That's the fear. Because my whole knee will go. There were two patients in my life who came and told me ki dotor तू नवे joint घालतले घाल, पण पोन्नी मात म्हाका दी. Okay, it's like car parts getting replaced. So for them, in a knee replacement, what we do is, if I'm comparing this, here you have a cartilage wear out, a complete loss of cartilage. I would go and here goes the knee. I would take a cut to the bone, giving it a proper shape. I would cap this with a metal. I would cap this with a metal and slide a plastic in between, and that's a knee replacement. I don't replace your ligaments, I don't replace your muscles, I don't replace anything of it. It is just capped. You can just compare it to a dentist capping your tooth. So in the past we used to just fill up the tooth. Now we have understood filling is of no use. We fill it and cap it, and that's just. So exactly that. A knee replacement patient generally will walk by evening of surgery, and they go home by the second or the third day. They start doing their own work. They don't have any bedridden life. None of my patient has ever had a blood transfusion if the hemoglobin is about 10, and they have a pretty normal life after 1 month.
So this is how a knee will look, sir.
This is exactly the knee which it will look.
Okay.
And your ligaments, tendons, everything will remain the same. Nothing is changed.
How long I will not be able to walk, sir, after surgery?
Exactly, I told you. I always tell my patient, you don't need a bedpan, you don't need a diaper. Next morning, you walk to the toilet to pass your motion. Absolutely no bedridden life. Third day, my patients, when they go home, they can cook their own food and have it. They are independent. So the most important thing is, when I speak to a son, he will always feel that whether I'll need to take care of my mother, not necessary. Third, fourth day, they will do most of their work of their own.
Sir, this knee metal, will it last forever?
So a knee is supposed to last between 15 to 20 years because that's the life of the plastic, and that's the life of the cement which we put in between the bone and the metal.
Okay.
So that's a life of around 15 to 20 years. It may last longer. There is no expiry date for this.
Okay.
I have some of my patients now. This is my, I think, 24th year of replacement surgeries. Even the first few patients are still doing well. It depends on how you use it. Okay.
Yes. How can I keep my knee strong for life, sir?
So, stay healthy.
Yes.
See that your BMI is between 20 to 25. Exercise should be the first thing in the morning. It should not be a leisure, like I said. What is wrong in India is we consider gymming or yoga as a weekend schedule.
Yes.
Okay, it should be your everyday morning. If you go abroad, you will see everyone first thing in the morning they are with their aerobic exercise. After that, they open their mobile phones and then they think about their day, which should be done by every Indian.
Yes, sir. Their day starts with exercise.
And our day sometimes never ends with exercise.
Right, true, sir. So, sir, what do you think about AI and robots helping with the knee replacement?
See, as we all know, the world is going towards artificial intelligence, robotics, and till now the time has not come where robots can replace a surgeon, because for that we need something like humanoid robots who will go and do. At present, what robots we have can take cuts of the bones.
So, doctor, now let's check with few facts about knee arthritis and bust few myths that only we in Indians seem to follow and suffer for. Okay. So, losing 5 kg of body weight really reduce knee pain?
Absolutely. Every 1 kg will actually increase the stress on the kneecap, the patella, 4 times. So that's why maintaining a body weight is very important. You are talking about 5 kg, that means this kneecap is bearing 20 times less weight if you can lose that.
Collagen, calcium, vitamin D supplements really help?
Calcium, vitamin D does help. Collagen is under scanner. No available data that collagen can improve the joint life. Joint.
Climbing stairs and running make my knee worse?
Can. So if you are in stage 1, avoid impact activities like running, jogging. Avoid it. Rather go for a brisk walk. Okay. Yes, walking on a treadmill is bad almost all the way. Why? because a treadmill has a steel floor. There's very thin rubber over it, and when you're impacting on it, especially when you're running on a treadmill, you are bound to damage your ankle and knee joint. Rather, in Goa, run on a beach. It's a more forgiving soil. It's a soft soil. You can run 5 kilometers. It will be better.
Okay. Cracking the knees increase the risk of arthritis?
So basically, the cracking of the knee means that you have already come to stage 1 or stage 2 arthritis. Okay? You're already the beginning of arthritis. Now in this, if you try to overexert that joint, okay, you're definitely inviting problems. It will not worsen your arthritis, but it will give you a phenomenon which is like a transient synovitis, a sudden swelling in the knee joint, which the patient will not like, and he will end up taking a paracetamol or something like that to reduce the pain.
Okay. Cold weather worsens the joint pain?
Cold always increases pain perception. It does not worsen the disease, but a patient is more sensitive to pain when it is cold.
Stopping all knee joint movements help recovery faster?
Never. Exercise is required even in a traumatic knee to some extent, and that exercise has to be increased slowly because, as I said in the beginning of my talk, all joints in the body are auto-lubricating. So the more you keep moving it, the better the joint will recover. Unless there is a fracture, wherein we are more interested at that time about the fracture stability, we would give a plaster for a small time.
Oil massage to the knees help cure arthritis?
It does not cure arthritis, but any sort of massage, whether it is oil, the gel, they are basically counter irritants. So when you rub there, you get a better blood supply there. And blood is a healer. So wherever the blood supply goes, it will try to heal the cartilage, it will try to heal some ligament injuries, and will make your knee feel better.
My mother uses oil, so it is okay, like she should.
But just oil will not work. Tell her do a hot fermentation before.
Okay.
After that, apply the oil and then start the exercises around the joint. Like there are exercises for the knee joint, there are exercises for the back, exercises for the neck. All these are basically finally joints. So both three things together will work better for her.
Thank you. Arthritis eventually ends up with surgery?
Not necessarily all, but yes, knee replacement has been a boon to the stage 3 arthritis patient. Patients in the past used to take up a wheelchair or a walker and walk the rest of their life, are today independently walking with replacement surgeries. Not all arthritis should land up, but mostly joint replacement is recommended for the weight-bearing joints like the hip, the knee and the ankle, where they take the weight. So if they are damaged, you are not able to walk at all.
A big thank you to our guest, Dr. Ameya Velingkar, for sharing such valuable insights today, and thank you to all our listeners for joining us.
Thanks, Asha, for having this. I would really like to thank Radiance Diagnostics to having such a nice Viewbox, wherein the people in Goa will be so educated with the basic topics. And thanks for this first initiative which you all have taken.
Yes,
and you should spread the knowledge, because we all have heard knowledge is power, and knowledge always grows with sharing. And it's a wonderful task which you all have taken, and I wish all the members of Radiance Diagnostics all the best. Thank you.
If you found this episode helpful, share it and let us know in the comments what next you would like to hear. See you in the next one. Until then, stay tuned, stay healthy.